Okay, let's jump right into this explainer because we're looking at something truly fascinating and honestly a little misunderstood. Have you ever stopped to wonder what's actually happening inside your body during the absolute very first week of pregnancy? Well, today we're demystifying week 1, breaking down the true timeline, and taking a backstage tour of what your biology is really up to.
If you've just started trying for a baby, you know exactly what I'm talking about. You're probably watching your body like a hawk, right? Every little twinge or tiny change has you asking, wait, could I already be pregnant? And it's completely normal to feel a bit anxious and want those answers right away. But the biological truth about this specific week, it's probably going to surprise you. So here's the huge twist that causes so much of this confusion. When doctors tell you that you're 1 week pregnant, you're usually not actually pregnant yet. I know, medical math is super weird. The dating system actually calculates the startup pregnancy all the way back from the first day of your last menstrual period, not the actual day conception happens.
To clear all of this up, here's our quick roadmap for today's explainer. First, the week 1 paradox. Second, your biological backstage tour. Third, the real timeline of conception. Fourth, we'll cover fact versus fiction for symptoms. And finally, preparing for the journey.
Okay, section 1, the week 1 paradox. Let's get right into it. Because of that quirky medical dating system we just talked about, your pregnancy journey technically kicks off with your menstrual cycle. Yep, day 1 is literally just the first day of your period. So if you're technically 1 week pregnant, you're actually just having your period. Since pregnancy didn't happen last cycle, your hormone levels drop and your uterus sheds its old lining, the endometrium. Basically, your body is clearing house to build a brand new foundation. All right, moving on to section 2, your biological backstage tour. Picture a bustling theater backstage, right inside your ovaries. While you're dealing with a totally normal period on the outside, there's just an incredible amount of activity on the inside. Step 1, thousands of immature follicles are waiting in the wings. Step 2, hormonal signals fire off like a starting gun, pushing some of them to develop. And then step 3, a single dominant egg steps right into the spotlight, prepping for ovulation. Now, while the ovaries are putting in the hard work, the rest of the reproductive system is actively prepping for a VIP guest. As that dominant follicle develops, your estrogen levels start to climb. This tells your body to build a plush, new uterine lining, making it thicker and super welcoming. At the exact same time, your cervical mucus changes, becoming thinner and clearer. It's this brilliant biological design meant to create the perfect slip and slide to help sperm travel.
Let's hit section 3, the timeline of conception.
Let's just walk through this precise timeline so we can really understand the reality here. Day 1 is when your period begins, but it's not until days later that ovulation happens and releases that carefully prepped egg. Only then, around that fertile window, can conception actually occur. From there, it takes several more days for that newly formed embryo to travel down to the uterus and implant. And the wildest part? It takes weeks after all of that before you even get noticeable pregnancy symptoms.
And that brings us to a really deeply human frustration. You feel like maybe, just maybe, something is happening. So you take a pregnancy test during week 1 and you just stare down at a glaring negative result. It is incredibly disheartening. But based on the timeline we just mapped out, a negative result right now is completely expected. The reason for that negative test is actually super simple. Implantation hasn't happened yet. See, home pregnancy tests are looking for one very specific thing, which is HCG, the pregnancy hormone. But your body doesn't even start producing HCG until after the embryo physically attaches to the uterus. So during week 1, there is literally zero pregnancy-related HCG in your system. Taking a test right now is just going to give you a frustrating negative and a bunch of unnecessary confusion.
Which leads us perfectly into section 4, symptoms, fact versus fiction. When you really compare them side by side, normal premenstrual symptoms and early pregnancy symptoms, well, they're exactly the same. Cramps, tiredness, breast changes, mood swings. Your hormones naturally fluctuate all throughout your menstrual cycle, and they produce symptoms that mimic the exact feelings of early pregnancy. It's a cruel trick of nature, really, but it proves definitively that you cannot rely on feelings alone right now.
But what if you feel absolutely nothing at all? Like, what if you just feel totally normal? Well, that is completely expected too. A lot of people just assume they're going to instantly feel nauseous the second they conceive. But according to the NHS, classic symptoms like nausea and vomiting commonly don't show up until around 4 to 6 weeks. So feeling perfectly normal during week 1 isn't just possible, it's actually the standard biological experience. Now, while mild cramps or normal period symptoms are totally expected, it is absolutely crucial to note that there are certain symptoms you should never ignore. If you think you might be pregnant and you're experiencing significant pain, heavy bleeding, fainting, or severe dizziness, you need to seek medical attention right away. Early pregnancy bleeding and pain can have a lot of different causes, and things like an ectopic pregnancy require urgent medical assessment to make sure you're safe.
Okay, Section 5. Preparing for the journey.
Even before you get that positive test, week 1 is the absolute perfect time to support your body's backstage preparations. Eat a balanced diet, stay hydrated, and get plenty of rest. You want to avoid smoking and skip the alcohol if you're actively trying to conceive. And crucially, this is the time to chat with a doctor about prenatal vitamins, especially folic acid, just to ensure your body has all the raw materials it needs for the journey ahead. If you take away just one thing from this explainer today, let it be this. Your body does not need to feel pregnant for pregnancy to happen. You don't have a baby bump, you probably aren't nauseous, and you might just feel exactly like yourself. But remember that bustling theater? There's an enormous amount of quiet, invisible biological activity unfolding right this second as your reproductive system preps for the possibility of conception.
So, if you're currently in pregnancy week 1, don't panic over a lack of symptoms. Sometimes the biggest changes are happening long before you can see them. Your body may be quietly preparing for something truly extraordinary. Which kind of makes you wonder, if so much is happening before the pregnancy even officially begins, what incredible biological milestones are waiting for you in week 2 and beyond? Thanks for joining me on this explainer. Keep learning and keep wondering.